Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Husni Hussaini bin Hashim. My matric number 058975. And today I want to present about the diagnostic acceptability of radiographic image. So my lecture is Puan Azima and Puan Azlina. So for the first slide, we will talk about the placement. Placement is the systematic methods of learning how to critique the radiograph is to break the critique down into these 7 parts. So placement have 7. So for the first one is the poisoning. Second one is A for the area of interest. The 3 is a collimation and center ray. Next is E for the exposure criteria, N for the marker, A for the alignment and artistic, and the last one is the names of identifications. So this is very important to critique the radiograph. We use the placement. For the next slide is the projection. For my projection is the lateral finger. So lateral finger is a lateral view of the distal, middle and proximal phalanx, distal metacarpal and associated joint. So I will tell you about the next slide. So yeah. So also for the first is the position. So for the position is the for the position is interphalanx and metacarpal phalanx joint space should be open. So this is interphalanges, and this one is the metacarpal phalanges joint, and this should be open so long as these of the finger should be aligned to such borders of image receptor. Finger should be in true lateral position as indicated by the concave appearance of the interior surface and straight appearance of posterior aspect of the shaft of the phalanges. So this radiograph is good for the lateral position in the lateral position, and yeah, and we go to the next slide. So this is slide for the patient position. So the patient is sit at the ends of the table with elbow flats about 90 degrees with hands and wrist resting on cassette and finger extended. Okay, next we go to the second. For the placement is A for the area of interest. Area of interest we describe about the precisely what anatomy part and structure should be clearly visualized on the radiograph. So the lateral index finger, second digit structure that need to be included, we have a 6. First is the distal phalanx, second middle phalanx, third is proximal phalanx, fourth is distal interphalanx joint, and 5 proximal interphalanx joint, and the last one is the metacarpal phalanx joint. We have a 3 joint. So this over here we have a distal phalanx. The second one is the middle phalanx. And this last one is the proximal phalanx. While for the joint we have this part we have a distal interphalangeal joint, and the second one is the proximal interphalanx joint, this one, and the last one is the metacarpal phalanx joint. So we go to the next slide. For the third is a collimation and center ray. For collimates on 4 sides to area of affected finger, center ray and center of collimation field should be to the proximal interphalanx joint at this part. It is the center ray for the collimation field. So center ray are perpendicular to the image receptor, for the image receptor, and directly to the PIP joint, which it is a proximal interphalangeal joint, and the minimum SID of 100 cm. 4 is for the exposure criteria. For the exposure criteria is the describe how exposure factor or technique can be evaluated for optimum exposure for that body part. So this part we use 45 until 55 kbp, while for the MES we use 3 until 5 MES. For it is the optimal density and contrast with no motion demonstrated soft tissue, margin and clear sharp bony tempicular marking, so it can avoid from any motion. And X-ray, because of this, the X-ray is very fast capture, so we need to always advise to the patient to always not do any motions during the capture, X-ray capture. So we go to the next slide. For the 5 is for the marker. For the marker is image marker should be placed so that they are not superimpressed over essential anatomy. So the Palmer marker should be present in the radiograph as evident. So this radiograph is is present in the radiograph. Anatomy marker is present in the radiograph. So you can see that the marker should be in the right position of the radiograph. So this projection is a true marker at this position, because we use this for the left finger. So this radiograph is the correct marker position. For the next slide is for the alignment and artistic. For the alignment, we use the size of gusset is smallest, which is 18 times 24 cm for this radiograph. For the orientation, we use the crosswise. For the last one is the name of identification. For the name of identification is the information about the patient. So we have 4 criteria, 4 information of the patient. First is the name of the patient. Second is identity card number. Third is the examination date. And fourth is the department of examination. We can see right now there are no patient information regarding this projection. So this radiograph cannot use for the examinations. So I think for the last one for my slide is for the conclusion. So this radiograph is follow all the placement criteria except the names of identification of the patient. So this radiograph is follow all the criteria, but is not enough for the names of identification. So this projection, this radiograph cannot use at all. Okay, that's all for me. Thank you.